Sorry, my son came in. Since then, she has been treated at the Liver Transplant Institute in Oklahoma City. That doctor decided that he didn't want to work with Lacey. He said that because of her age and everything that was going on, he wasn't sure what to do. And he recommended we take her to the Oklahoma Cancer Research Specialist Center. And we've been seeing Dr. Manis there. He's wonderful, absolutely wonderful, wonderful doctor. He's been doing everything he can to get Lacey better. She's doing her infusion treatments. She's been doing everything, he's been doing everything he can to help her. He got her in touch with a physician named Dr. Ritterman, and because of her spleen being so large and putting so much pressure on all of her organs, she's in a lot of pain all the time. She's just kind of learned to live with it. She never complains. She cries sometimes, but anyway, we went to see Dr. Ritterman. We were very hopeful because what he was going to do is a procedure called a splenic embolization. And once they did another MRI and an ultrasound and did blood work, they got to looking at it, and they said that her anatomy is so different, and so he said he doesn't trust himself to do it. He doesn't want to do it. He does it on older people just to give them a quality of life. So he decided that he wants us to see another doctor in Dallas. Well, that has been this process that we've been trying to help her and get her the help that she needs has been 9 months now. 9 months. Just last month, I took her to the hospital. Again, she was crying and a lot of pain, very nauseous. She's nauseous all the time. All the time. I took her to Hillcrest Medical Center hoping to get to the Children's Hospital. They told me because she was 18, I had to take her to the other hospital. When we got to the hospital, the attending physician that was on duty, he looked at my child and kind of put his hands up, and he said, "I don't know what it is you expect me to do, because I don't know how to fix this." All she wanted was just to get her out of pain for a while. Just give her something for her pain. We know that she's going to have surgery to have it fixed. We know you couldn't fix it on the spot. But like I said, it's been 9 months that she has struggled and tried to keep up her spirits. It's so hard. You know, after speaking with Dr. Rinderman, and they decided not to do this splenic embolization, we're waiting for a call from the doctor in Dallas. I have been waiting and waiting and waiting since May to find out when she's gonna have something done. Oh. 2 nights ago, she came into my room. It was actually the night of her birthday. Came into my room crying. And she said, "Mom, something's wrong. Something's very wrong. I can't remember things." This is the second time it's happened to her. She couldn't remember if she turned the lights off. She's had it where she doesn't. I'm so sorry. She's been with her sister and has come home and said, "I don't remember driving home with Stevie. My child needs help." Nobody is willing to give her the help that she needs. I'm begging for somebody to please, if you see this, please, please. She's only 18 years old. She's my baby. The doctors, I know they understand they can only do what they can do, but there's got to be something somewhere, somebody that can help her. It's taken a toll on us completely financially. We're completely devastated, and my husband lost his job because he took a couple of days off to be with us at appointments. It was very important for her father to be there with us. I need him for support. She needs me for support, so we're supporting each other. But these doctors don't understand. They don't see what I see. They don't see my baby crying and wondering how long is it going to take, Mom? When is it going to be over? I just want to be normal. I want to feel better. I'm so sorry. I'm sorry. But somebody's gotta know something. Please, can you share this? Her name is Lacey. Again, I'll show you another picture of her. She's absolutely amazing. She's just the most precious girl. For character, she really is. She's a very funny girl. She's one of 8. She, of course, was the baby. She's a fighter and she's strong, but it's very hard. Oh, excuse me. It's hard to stay strong when nobody's helping. I just want some answers. I want to be able to help my daughter. And if you've got kids, you've got to know this is the hardest thing for me to do. Is to just watch her and just hold her. That's all I can do. Hold her and rock her. Because I can't give her the answers. I can't help her. Please, if there's a doctor that has ever heard of anything like this happening in an 18-year-old child, please, please, please share this a million times and contact me, please. We live in Tulsa, Oklahoma. I'm so sorry. I should have got some tissues. I'm sorry. But I'm leaning on my faith, and I have faith, and I know that somewhere, something's gonna happen. Somebody's gonna help her. And one more thing. I did start a GoFundMe campaign for her. It's under her name, Lacey Tester. And after I started it, I started getting a couple of bad messages from people telling me I was ridiculous, that why would I be begging for money for my child? I would take a bullet for my child in a second. I would be standing on the street corner begging for my child if I had to. She's my child. Any one of my children, without not even blink of an eye. You don't have to ask me twice. Don't even ask me. It's done. I would give my life for any of them. Done. Period. Anyway, so sorry. Please, 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 just share. And be kind to people. You never know. They may look fine from the outside. She looks absolutely perfect. But there's a storm raging inside her that nobody sees. She fights through it. She works through it. So please, as Ellen would say, just be kind to one another, because you never know what they're struggling with. Thank you so much for taking the time to listen to a mom ramble. Take care, and God bless.